This is your Houston chiropractor, Dr. Gregory Johnson, and we have Noe here with us today.
Noe.
That's what I said, Noe.
Okay.
And today is his very first time in our office, and we have already evaluated his posture, and I just did his orthopedic neurological test, which shows us that he has multiple herniated discs in the lumbar spine. He also has sacroiliac subluxations in his pelvis on the right and left, as well as sacral deviation on the right side of his sacrum, which is sending pain down through his buttocks and into his legs and into his toes with numbness and tingling. We check his leg length, and you can see his right leg short by about 1/2 inch. I bring it up, it actually gets longer on the right side, and that hurts a lot, doesn't it, your lower back? So that is a positive Knockless and Deerfield test on the low back, and also a Deerfield on the right. Now I want you to lock your leg straight, Noe, on this right side, and I'm going to push here. You lift up your whole right leg for me. No, the whole thing. Does that hurt on that right side?
Yes.
That's what I thought. Do the same thing over here. The right one's worse though, huh?
Yeah.
Yep. Okay, you ready to feel better?
Yeah.
All right. So we're going to adjust him. First time adjustment, by the way. This is his right SI joint. And I'm adjusting him with drop pieces, which is BioPhysics and Thompson work. Sacrum, we're going to adjust the right posterior sacrum here in the Z-axis and the Y-axis. Now I'm going to adjust the left side of his sacrum, straight down in the Z-axis and the Y-axis. It's mostly a superior inferior type of line of drive. And now his left SI joint, right there. There we go. Now we're going to move up to his first lumbar vertebra next to the sacrum, which is L5. That's the first herniated disc there. Then we have L4-5 here. How do I know that? Because we did the sensory test and muscle test on his lower extremities. Big toe numbness, L5. Bottom of the feet, sole, and calf, S1. Now, just relax this. This is L3. That's also out. Oftentimes accompanying patients who have chronic low back pain and spasm or herniated disc, you'll get bowel and bladder complications, constipation, diarrhea, loss of ability to hold that, which is incontinence for urinary tract. And then if you lose control of your bladder or bowels, you should get to a hospital and have emergency spine surgery within 24 hours, or you'll be wearing a colostomy bag or urine bag for the rest of your life. We always make our patients aware of that. That usually only happens with spinal canal stenosis or cauda equina syndrome, which is the very tail end of the spinal cord where it turns into the filum terminale. Around L2-3, it flares out and separates out into individual nerve roots and slices. The spinal cord does. But what we are doing right now is we are adjusting him three-dimensionally in the X, Y, and Z axes. Now I'm going to put your head forward just a little bit here now. Scoot up in there just a little bit for me. Good. Okay, so now just breathe though. Keep breathing. Remember, this is first one, so it's going to be sore in some of these areas. And just exhale. There you go. Okay. Keep exhaling. There you go. Just keep breathing. That's it. There we go. Good. Okay. And there we go. He's got a lot of muscle spasm today, so he's very, very hypertonic. But we're going to work on that right now. Now, deep breaths for me. This is just my elbow. Wait till I get my knee in there. There you go. Now, just start off slow and then work down deeper as I get into them. Now, even this is one of those hurt so good things, though. It just feels a lot better when I get done. And it feels a lot better when it quits hurting. That's my favorite line. There we go. And then right down where the low back muscles meet the pelvis right now at L5S1. And now, you're going to really like this one. This is the gluteus medius and maximus. Then we get down into the piriformis. I know that's real sore. Okay, again, this is one of those hurt so good things. He's kind of crying and laughing all at the same time, guys, so give him a break. This is his first time ever. Like I said, he'll feel a lot better when it quits hurting. Okay, now, I'm going to let him breathe for a second. But, look at the difference already. See how his legs evened up? And I bet you this feels easier than the last time.
Oh, yeah.
Yeah, look at that. Imagine that. Alright. Now, I'm going to take it easy on you, Dan. I'm not going to turbonate you today. I'm just going to do the deep tissue vibration with the genie rub. This just increases the blood flow and circulation into your tissues and helps relax your muscles. So just keep breathing. The thing you can do to help us out the most is just breathe. And that's the thing a lot of patients need to learn how to do is deep breaths in through the nose, out through the mouth. Slow, long, deep breaths, not rapid style breathing like you did have a baby. What do they call that?
Lamaze.
Yeah, don't do any Lamaze breathing. Do just long, deep breath. You'll see a lot of patients doing Lamaze breathing on their first adjustments, but that's just because they're hurting so badly. But he'll feel a lot better when he gets done here. I'll let him tell you. I won't even tell you. This is all unrehearsed too, by the way. It's all spontaneous, huh? Yeah, there we go. Yeah, you're gonna come to love my elbows. Your back will anyway. You're gonna have the best night's sleep tonight that you've had in a long time.
Oh my God.
Because this has been interrupting your sleep too, I bet.
Yeah, it's hard to sleep.
But remember, do you see how short his leg was a while ago? Look at that. It's exactly even, and it stays even the whole way. That didn't tighten up hardly at all, did it? That feel better that time?
Yeah.
Okay, let's turn you on your back now. Just roll over like you were turning over in bed, slowly. Don't worry, I don't have any heads on my trophy wall yet. I won't start with yours. This is rare that y'all get to see me adjust in a really serious first-time severe chronic pain patient that's been dealing. How long you been dealing with this? How many years? 8 years?
About 8 years.
Put your hands right here on your tummy. There you go. Now just let your head go in my hands as if you're sleeping. Perfect. Oh yeah. Very good. Let your shoulders relax and just take a breath. There you go. I know. We're gonna get your ribs lined up here too. Now, I want you just to keep breathing and relaxing. Let me have your whole leg here. Just let it go.
Oh!
Now you should have felt that in your knee all the way up in your back, did you?
Oh, yes.
Alright.
Oh.
I love when we have all these sound effects. Okay, you gotta be quiet because they love hearing the cracks. Alright, let's have you sit up sideways, remember? Turn sideways. There you go. Good, perfect. And just sit right there for a second. We're not done yet. The best part's yet to come. Okay. Here, let's scoot back this way just a little bit. Let me just check your shoulders. Now, he's got just a little bit of crepitus, which is popping and grinding in his shoulder. Did you feel that move? Yeah, he's still taking those deep breaths, remember? Okay, now we're going to do the lifesaver for you. Let's come over on this table over here. This is what you came in here for right here, the decompression. See, he's got herniated discs, so those discs are squished out like you just smash a jelly donut on a table. It's squished out all over the nerves on the sides and the back. So we're going to create a negative vacuum in his lower lumbar spine disc that will suck back that nuclear material right back into the disc. Let's slide down this way just a tad, right there. Good. Okay, now I'm going to pin you in this fairly tight, so if you just put your hands right there and relax. And again, this is a very first time manual spinal decompression, so he has no idea about what's getting ready to happen unless he's been watching our YouTube videos on it. There we go. Let's slide you down this way just a little bit. A little bit more. Slide straight down. Okay, now suck it up. There you go. Okay. Now just relax and breathe. Keep deep breaths, remember. Not Lamaze breathing, but deep, deep breaths through your nose. Exhale through your mouth. There you go. Try to breathe in from here up, and then exhale from here, and then push it all the way up to your solar plexus. The best way to learn how to breathe properly is to get into martial arts. That's where I learned how to breathe properly, and you get power from that too. See, his reflexes are both functional on both sides. So, what I'm getting ready to do now, Noe, is I'm going to wrap this wet towel around your skull and around your chin. So there you go. Now lay your head right on back. And I want you to take that deep breath through your nose again. Keep your teeth together. Let all your air out now and just relax. There you go. There you go. Now you should have felt that all the way down, did you? Deep breaths for me. Deep breath. And he's still kicking. There you go. Did you feel that all the way to the bottom?
Yes.
Okay. Keep taking some deep breaths. Don't hold your breath like that. There you go. Now, folks, he's in a lot of pain. He came in here in 8s, 9s, and 10s pain levels. So, the very first time you get this done, it's not going to be a cakewalk. But let's have you go ahead and turn over this way and stand over here in front of the mirror again. I'll help you up if you need me to there. Sideways, remember. There you go. Yep. There you go. I got you. Okay. You okay? Let's see if you can stand up here in front of the mirror for me again. It should start to feel a little bit better here when you're standing now. Go ahead and face the mirror for me. Let's see, he's moving better right now already. Okay, now I want you to close your eyes again for me, Noe, and flex your head forward and then backward again. Yeah, much better range of motion there. Now back to normal. Now see how that brought his head back further?
Yes.
Quite a bit. See where his hands are now? Look at the difference from where it was before. Remember how much space we had? Difference?
Yes.
Look at that. It's more even now.
That's even.
Now, so here's the last part we're going to do, Noe. Lift your shoulders up and back. This is what I want you to hold right there. Flare these arms like this, palms forward. This tightens up your entire trapezius muscle. Do you feel that? Now we're going to bring your head straight back, and because yours is a little bit to the right, we're going to go left. Look in the mirror for me. That way you can see. This is exactly opposite of that. Now I want you to shift your pelvis straight to the right for me, just like this. Yep, hold that right there for me, please, just for a second. Tap your elbows right there. Right there. Okay, just keep breathing and relaxing. Okay, now I want you to relax everything. Okay, now I'm going to stretch your trap muscle out, and I'm going to hit the muscle spindles in here and lengthen those with the Golgi tendon apparatus. Get into his rhomboids and down into his lower trapezius muscles, which are still pretty sore. But, okay, start back to neutral for me again now, Noe. Now, let's have you go forward and backwards again, and I want you to tell me how this feels compared to that first time. Look at the difference in range of motion. Back to neutral. I should have felt smoother too, did it?
Yes.
Okay, back to neutral for me. I'm sorry, I know this is smart. I'm not making light of his condition and whatsoever, because he has a very serious condition that we're treating in that way. But look how you're even here now. And you see how your shoulders are squared off and your head's up and back?
Yeah.
That's your new you right there. And that's the you that we have to keep this pressure off the disc in the low back and all the way through your spine, really. Walk around for just a second and tell me how that feels.
I feel way better. I feel good.
You feel lighter?
Yes.
Yeah. So this is your first adjustment like this ever, right?
Ever.
So was it worth the going through the process?
Yes.
You feel that much better?
I feel better.
Yeah.
I
Now,
can
it's
feel
not
a
going to
little
go away
bit.
overnight because it didn't get that way overnight, but it will go away predictably if you do the things that we talk about and you and I work together as a team. Which I'll be giving you home exercises and do's and don'ts, how to sleep properly, how to sit properly, how to stand, work, bend, lift, twist, all that stuff. So as long as you and I work together as a team, we'll get you the results you need. Do you have any questions for me at all? And it's not going to hurt this bad every time. I look forward to working with you. God bless.
Thank you.
And we do pray for our patients' healing every day, so you can bet that Renee and I are already thanking God for your healing that's taking place. So, how does your low back pain feel right now compared to 6?
My lower back, I don't feel it much.
That's great.
I just feel the
Tightness.
tightness, the tender of.
Yeah, that lower thoracic region. Compared to 10, though, what's that?
5, 6.
Okay. And rib cage pain right now?
No.
That's probably gone. Yep. And how about the acid reflux? Any of that?
No.
Okay. Upper back was also a 10. How's that feel right now?
I feel my pressure.
Gone?
My pressure's gone.
Great. Praise the Lord. And how about your left leg pain right now compared to 4?
Good. Good.
Gone?
Yeah.
Good. Are you having any of the left SI joint pain right now?
Just a little bit right there.
Okay. 1, 2, 1.
Yes, 2.
Okay.
3, 2.
And how about numbness and tingling in your big toe right now?
No.
Gone? Good.
Gone.
How about headache right now?
No.
Great. Anything new now that you didn't have when you walked in the door besides sore and better?
Better.
Okay,
Just feel
great.
better.
Praise the Lord. Good. So, Noe, would you mind telling our YouTube subscribers how you came to see us and if this is worth your visit here to us?
Yes, it's worth the visit. Just so much pain. Been on pain for years,
And you've seen other doctors for all this, right?
Yes.
Had MRIs done, X-rays, the whole works.
cortisone shots.
Everything. The next thing they told you was surgery, I'm sure.
Yeah, probably no. It's
You're not
common,
getting surgery though, right?
No.
Good. We're going to help him not get surgery. So thank you, Noe, for sharing your story with everybody. And we'll be seeing Noe again in the future. We'll be following his progress. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.